Welcome back to STL TV Live. I'm Sarah Bernard, and my new guests are Michael Austrin and Loretta Ford, and they're from another St. Louis nonprofit that works with underprivileged children in our own community. Welcome to the show, Loretta and Michael.
Thank you.
Thank you. Tell us a little bit about your organization that's helping children and their health care in St. Louis.
Well, Health and Dental Care for Kids has been here for about 20 years.
Okay.
We serve approximately 37,000 patient visits a year.
Wow.
That's combined medical and dental.
Wow, 37,000.
Yes.
And so you're staffed up with dentists and doctors and everybody that can help
And dental
these kids.
assistants, medical assistants, nurses, receptionists, everybody who can help the patients.
Okay.
We're open 7 days a week.
Really?
Mm-hmm.
9 a.m. to 9 p.m. Monday to Friday.
You guys are busy.
Oh, yes.
So, and how do people find out about your organization and who can come?
It's kind of interesting. Health and Dental Care for Kids has been here a long time,
Yeah.
But it's really been pretty much word of mouth.
Okay.
It's been community. We're known through the community, but just the basic community.
So are families, are they recommended by their schools or?
Yes.
Okay.
Schools.
GYN offices, once a mother gives birth.
Sometimes the hospitals.
Okay, they're referred to your organization.
Yes.
So 7 days a week, a family can come and get dental and health care for the kids.
Yes.
That's awesome. And so what other things do you do besides, is that pretty much, I mean, I know that's a huge task right there,
Right.
But are some other things that you wanted to highlight about your organization?
Well, all the doctors are board certified pediatricians. There's 7 pediatricians, there's 12 dentists. Like I said, they work 7 days a week. They work on Saturdays and Sundays. They're open the evenings for pretty much urgent care. You're talking about a place that has about 120 to 150 children coming in per day.
Wow.
Plus the parents.
Yes.
There's a lot of traffic.
Yes.
Yeah,
Yes.
that is a lot of traffic.
Yes.
And the doctors and dentists who are there full-time? They only work at your office, or do they work around town and come in as needed, or how does that work?
The physicians do. The dentists, there's some that work at other places too, and they bring extra time to us.
Yeah. So kids from newborn to what age?
18 years of age.
Okay.
Absolutely. Until they're ready to go off to college.
Yeah.
Absolutely.
Yeah. That must be really exciting. Now, 20 years, have you seen kids of patients come in yet? I mean, are you in the second generation?
Yeah,
Yes, we are. Second and third, some third generations.
Yeah.
Yes, we are. Absolutely.
Yeah. Yeah. And tell us about your jobs. What are each, Loretta, why don't you tell us a little bit about what you do?
Well, basically, I'm the practice administrator, and I'm responsible for assisting Michael in overseeing operations, day-to-day operations, and most of the HR administrative work, interacting with the physicians, making sure that all of the necessary business aspects of the organization is carried out.
Yeah, and how long have you been with the organization?
Both Michael and I started 2010, October, the same day.
Okay.
So we both arrived the exact same day to the organization, and it's been quite exciting since.
Yeah.
I'll say.
So tell us, why is it so exciting?
Well, you know,
Just working together, because you two do seem like a good pair.
Yeah, and he's a great guy. But you know, we never know from day to day what to expect in our organization. You know, we have kids that are coming in that are being treated for various illnesses, and sometimes kids are coming in for school physicals, immunizations, and things of that sort. And sometimes there's people coming in that are looking to, you know, get help with the kids' behavioral issues.
Okay.
So we have doctors that are specialized in behavioral issues as well.
So psychiatrists, psychologists? And
No, they're pediatricians.
Okay.
But they specialize in ADHD,
Right.
Okay.
for instance. And that's one of the up and rising behavioral issues.
Right.
Right.
We also have on-staff social workers, so they can help with some issues too.
Okay. You've got it all. So Michael, what about your job? Tell us about what you do.
Mine is an interesting position. It's the chief operating officer, and although I'm responsible for running the place, I also have other aspects like marketing, getting our name out there, and actually once in a while I'm the maintenance man too.
Yeah.
We wear a lot of hats there.
I get that.
lot
A
of
small
hats,
organization, but big in your scope, but
Sure,
it's
Well,
small in
it's a nonprofit, and
Yeah.
90% of our patients are on Medicaid.
Oh, wow. Okay.
Yeah. And then there's about 5 or 6% that are uninsured.
Yeah. Okay.
And then we have a few, maybe 3 to 5% that have commercial insurance as well.
And you take those?
We take all insurance.
You've got it all.
Yeah,
we don't turn anybody away.
Yeah, we don't turn any patients away for inability
well,
to pay.
I love the fact that you've got health and dental all in one building, because one time I calculated how many times I've got to go to the dentist and doctor with my 3 kids on an annual basis, and it was pretty high. So I would love to be going to one place, I can tell you that. So we have to take a quick break, but we're going to be back in a second, and we've got more to talk about with Michael and Loretta when we come back. And as always, to keep up with STL TV and all the great events going on around St. Louis, friend us on Facebook, follow us on Twitter, and subscribe to our YouTube channel. And you can always catch us, watch us streaming live on STLtv.net. And don't you know by now, if you want to really experience St. Louis, you have to watch STL TV. We'll be right back.